Okay, so for the general examination of the patient, we're going to start with the general condition evaluation. First of all, we need to observe the patient. She's at a suffering state, so the face is going to be altered. So you can say that the patient is semi-conscious, so the degree of the state here is going to be semi-satisfactory. So second of all, we need to examine the posture of the patient. So here, as she's laying down, the posture is forced due to the pain here in the abdomen area. So the conscious state of the patient. We need to do the Glasgow scale, observing the eyes and the responsiveness of the patient. We can evaluate here that she's at 14 or 13 at this scale. So then the posture that I already said is forced. The face here, we need to see some signs of hypovolemia and also a suffering face that is severe pain. So the eyes here will be sunken, the mucosa will be dry, will be paleness, etc. So for the evaluation, we need to see the patient's body constitution, the patient's normal standing. Okay, so we need to check the patient's face according to her age. So the patient here will look older because of the suffering pain face and her state. Then we need to check also the body constitution. The patient is normal standing, and we need to see the height and weight and also the circumference of the patient to evaluate. So the patient here in this case is healthy. Okay, so we need to evaluate the skin too. So as you can see, the patient is feeling a lot of pain. We need to see the color of the skin, if there are rashes, some scars. We need to see if the turgor of the skin, the degree of dehydration, the nails, and also the hair constitution. We also need to see the subcutaneous fat and edema, if edema is present, so we need to remove the boot and do the pinching test that we're gonna press the patient's feet and we're gonna release it, and we need to observe the seconds here if it's gonna return to normal or not. So for the subcutaneous fat, we need to evaluate in the anteroaxillary area and also in the posterior side of the arm, as well as in the lumbar region and in the medial anterior region of the leg. In this case, we need to check the lymph nodes, but it's not so important, as well as the muscular system and the osteal system, because we expect that the patient's healthy. The patient is very young. So then we're gonna pass to the face examination. We need to observe the eyes, the color of it, the lips, inside the mouth too, and also the nose, and as well as the head region. We need to palpate it to feel any trauma, deformation, scarring. And we also need to check the temperature in the body. So with the palmar costal part of the hand, we need to compare both areas of the patient. Check the temperature, and we need to check the thyroid gland as well, but it's not so important. So the patient is going to swallow, and we need to check if it is elevatable or purple over here. So during the abdominal examination of the patient, we need to palpate the patient to observe where the pain is spreading and where is it. So we need to observe the patient's face during all moments. So we're going to release the patient's arm, put him stand beside the body. So with two hands, we're going to perform the deep palpation. So I'm going to place my hand in the hypogastric region, and with circular movements, I'm going to palpate the patient in all areas of the body. As you can see here, the patient is feeling pain in the left hip region. That's characteristic for appendicitis.